My name is Shereen Hussein, and I'm a professor of health and social care policy at the London School of Hygiene and Tropical Medicine. My work is primarily around social care and aging. I have a large research portfolio in the UK, but I also have founded and lead a network that looking at aging and long-term care in the Middle East. It's called the Minara Network. I would say that when any one of us has developed a condition or has been born with a certain condition, they might not be able to do everything independently. They might need to have a little bit of support, like if you have a medical condition, you would need some support with medication or other kind of kind of intervention. But in the social side, usually these type of interventions are very social support, and that to make the person reach their capabilities and live a life that they want to live. So it's really rather than making things that too challenging that they can't do it, lower the barrier and support them to do what they want to do. So I'm a medical demographer by training, and I have been always interested in population change and how the demographic changes. And of course, in Europe, it has been an aged societies for a long time, and that evolved over time to think about different types of support. I am originally from the Middle East, and I have done at the beginning of my career lots of research around population studies, but primarily towards younger populations, particularly children and mothers. And I was really interested to see how can we learn from different countries and how we can support the evolving population needs of the Middle East. So the Middle East is going through a big transition, population transition, but also different socio-demographic transitions. And their experience will be extremely faster than Europe. So some of the countries in the region, particularly in Gulf region, they will move through this transition in 10, 12 years. And that is a very kind of a quick turn around for changing policy and changing priorities of thinking. So in 2018-19, I applied for the Global Research Challenge funding, and I had secured some funding to set up this network, and it has been growing very strong. Since then, there is many kind of policymakers who are interested. There's some countries really want to know what are the evidence, how can they support their growing population in a cost-effective way, while they have other competing priorities from the other segments of the society, particularly the youth pool. So the big portion of the society, which is quite young, needing education, housing, employment, and so on and so forth. And the network try to work with organizations like the World Health Organization, like the World Bank, the UN, to create space for policy development and also practical interventions for older people, but people who live with disabilities across the life course. So, in terms of aging policies in the Middle East, there has been some growing interest across the region. Clearly, they are not the main priority for policymakers because they constitute still a very small proportion of the population. And there are, of course, other competing priorities. As I said, kind of ensuring the health for all. They're still struggling with universal health coverage. There is high unemployment rates, the economic and fiscal situation, and the region in particular have been hit by conflicts and war and crises. But through this, there is good signs of attention. So the League of Arab States have put together an aging strategy in the last couple of years. There are some countries, particularly in the Gulf region, who realize that their transition is quite fast. They started to look at their long-term care services. They don't call it long-term care. They still think about disability support, but it's a good space to start thinking about the different types of support. And of course, there are sub countries within the region. So the Gulf region are high income countries, so they have the means to start new interventions and to test them and to try to implement. But other countries, either, for example, like Egypt, which is very populous, the economic situation is not great, but they also have been doing some work around pensions and pension reforms, which is a starting point again to think about aging. So I think what we're trying to do in the network is to leverage all these ideas and policy strands to channel it into the thinking around the changing population demands, and to think about it in a complementary way, because the young of today, you're trying to create jobs for them and to ensure their health, will be the older people of the tomorrow, and they are also currently the informal carers of the older of today. So I think it's all complementing. This hasn't ticked with all the policymakers yet, but there are good signs, and there are some great initiatives across the region. There is good representation of non-governmental organizations who are trying to provide help and support on the ground. In conflict zone, we actually see a lot of peer support. So in situation like in Syria, and I'm sure now in Palestine, usually the young are able to move out, but the older or who are less able to move or remain. And we find a lot of good examples of people supporting each other using their knowledge. So if they had medical training, if they had some psychological training, they support others. And I think it's about trying to collectively think about, actually practical solutions that is cost effective, that can have impact and change the quality of life of people who have the rights. And we think about that from a human rights perspective, that everybody has a right for a good quality life. In the region, the main problem of strengthening the system is in many places there is no system. And in some sense, this is a good opportunity to think afresh and not to try to get a system that doesn't work to work. But of course, it's much more difficult to get the foundation right. So that's this big leap is the main problem. So to admit that there is a need to create that long-term care system, or to capitalize on the efforts that already exist, because I said there are already efforts, because there are already older people who live alone, who are widowed, who live far away from their children or their social network. And you find a lot of community support and community help that is grassroots, bottom up. And I think for countries who are struggling with fiscal constraints, there is an opportunity to think creatively to leverage these efforts and to act as market shaper or the regulator who construct things in a good way, but use these activities. The problem that there is a lot of inequalities and there is gaps in the markets and there are opportunities in the market. So, for example, in some countries, because there is a need, you get a private market thriving. But this private market is not regulated, the workforce is not trained well, and the prices are very high, which is not what you want, because it's there is a problem with access, that it's unequal. People who have the capital can get it, but at the end of the day, you might get something that is not good quality. So states needs and governments need to understand that this is happening, and they have a role to play to not regulate and shape the market in a best way that would help both the individual receiving care but the workforce as well. So there are the long-term care is one of the most growing markets for employment, and the International Labour Organization have been publishing statistics about that. It creates opportunities in places when you have high employment rates for both men and women, and hence it provides opportunity to capture taxation, for example, and to leverage economic income for the country. But you can't do that if it's not regulated. So if people are employed in irregular formats and they are not paying taxation, then you're losing that. So I think there is a huge opportunity of thinking about the long-term care market that can help the individuals needing care, help their informal carers because you reduce the burden of care, but also help unemployed women to see this as a potential career or a stepping stone to a new career. But not only women, men as well, because we're seeing a lot of men who are growing older who might want to have a man carer. And also the long-term care sector as jobs, there are so many other jobs than just the provision of the frontline care. You've got care coordinators, you've got care managers, you've got IT who can support the system. So you've got a range of jobs that can attract a lot of the young people who are struggling to find jobs. So it's a win-win situation but you need that to be set at the priority, and then to get the kind of the government's buy-in to put together an intersectoral working group to manage this and mobilize it in the best way for all their population. And it goes very well with the universal health coverage, with also the economic targets and human capital building. But I think it's not so obvious to government, which is pressed for change, and they have a list of priorities, and you've got like 50% of your population in that age group, but only 5% in the older age groups. They're very easy to sway your decision. And this is what we're trying to do: is bringing people together, speaking through, well-reputable international organization that can then have weight when they talk to the government. So through working with the World Health Organization, with the United Nations, and with the World Bank or other big NGOs like Help Age International or other groups, so we can leverage their power.